This brief presentation will explain the procedures TERI non-public schools will use to protect staff and students from exposure to COVID-19 while at school. As of August 11, 2021, the state of California requires that all teachers and other school staff must be vaccinated or undergo weekly testing for COVID-19. The deadline by which this must be in place in all public and private schools is October 15, 2021. All TERI staff must provide proof of vaccination or inform their director that they are not vaccinated. TERI has been approved as a testing site for our staff only. TERI nurses will conduct testing and results will be processed by the county. More detailed information on specific testing procedures will be provided to staff in the coming weeks. All staff, students, employees, contracted providers, volunteers, and visitors must wear masks indoors. This includes wearing masks when transitioning from outdoor to indoor spaces. Mask wearing outdoors is optional at this time. When worn, masks must cover the nose and mouth at all times. The school will provide masks to staff and students needing them. TERI will not tolerate bullying or harassment related to mask use. Negative comments about mask wearing are not appropriate around students. Any instance of bullying or harassment related to mask use will result in disciplinary action for staff and exclusion from accessing the school building for visitors or other non-TERI personnel on site. If a staff, contractor, or student is unable to wear a mask for medical reasons, documentation of this from a medical professional must be provided to TERI in writing. Those with a medical exemption will be provided with reasonable accommodations to include the ability to wear a face shield rather than a mask. Those with medical exemptions will be required to complete weekly testing as specified by the CDC. Disability exemption. Students who are unable to wear a mask due to their disability, but not a medical condition, should be given access to a face shield. Staff are to assure that any student not wearing a mask for reasons not related to a medical condition will have at least one instructional session each day in which they learn to wear and tolerate either a mask or a face shield. TERI will enforce the requirement that all staff and visitors wear a mask indoors, unless otherwise exempt, by barring access to the school building for those refusing to comply with this requirement. When masks cannot be worn indoors when eating or drinking, all staff and students will physically distance to the degree possible until mask wearing resumes. If a student refuses to wear a mask, staff will work with the behavior specialist at their school to design a system of positive reinforcement for compliance. Until compliance is achieved, staff will assure that, to the greatest degree possible, the student is physically distanced from others. Students will not be barred from accessing the campus due to a refusal to wear a mask. Students not wearing masks may be present in non-public school classrooms. Schools will ensure that all employees, students, parents, contracted providers, and visitors know the school's policies on mask use. A link to this video presentation will be sent to all parents and contracted providers. Employees will view this video prior to the date that students return to in-person instruction. Signs on all entrance doors will inform people entering the building of the requirement to wear a mask. Students who are able to understand the information will be informed on their first day of school of the requirement to wear a mask when indoors. Recent evidence indicates that in-person instruction can occur safely without minimum physical distancing requirements when other strategies, such as masking, are implemented. The CDC has found that the chance of transmission occurring between children who are wearing masks is greatly reduced for close contacts who are at least 3 feet apart. They also note that physical distancing at 6 feet is particularly important while students are eating and drinking indoors. 6 feet of distance is necessary when employees who are not fully vaccinated have their masks off indoors, essentially when eating or drinking. Physical distancing indoors should be as much as feasible. Distance between students in the classroom will be maximized to the extent feasible by manipulating placement of desks and student seating. Employees, parents, contractor providers, and substitutes will be informed of our policy through viewing this presentation. A link will be sent and posted on the TERI website. Student, parent, and visitor distancing will be monitored by school staff as needed. The California Department of Public Health information on ventilation of indoor environments and ventilation and filtration has been reviewed by both school directors and their supervisor. In classrooms or shared spaces with doors or windows, these will keep open to the degree it is feasible. In classrooms or spaces without doors or windows, ventilation systems have been made available. These systems are maintained by TERI maintenance staff to assure maximum filtration is provided. No one, staff, student, or visitors, can report to or be present in the school when they are sick for any reason. Staff, parents, and regular visitors have received multiple written notices regarding this policy. New visitors must complete a screening before entering the building. Staff who are experiencing COVID symptoms must contact TERI HR for further information about their return to work. Parents of students who are experiencing COVID symptoms have been informed in writing that their child is to isolate at home and follow the directives of their doctor and the CDC. All TERI staff are required to screen for COVID symptoms prior to coming to work using the TERI-provided online platform. Specific staff are assigned to check the online site daily to assure that all staff have done their screening. Students and visitors to the program are required to complete a symptom screening form and have their temperature taken before entering the building. Parents complete the symptom form at home and send it with their student. Temperatures are taken before the students enter the building and must be below 100 degrees. The school director stays in close contact with the parent of any student who is absent from school due to illness, including COVID symptoms, to determine criteria for return to school. Directors also inform school staff of the names of students who are not cleared or are cleared to return to in-person instruction. TERI schools will use routine asymptomatic testing to screen unvaccinated employees as recommended by the CDC. This screening will be provided by TERI nurses. Depending on test results, TERI HR will work with the employee to determine any necessary quarantine or follow-up. TERI will not complete routine asymptomatic testing to screen unvaccinated students. TERI Director of Human Resources, Stephanie Eisenhower, is the COVID-19 liaison for TERI schools. She will ensure all documentation needed to contact trace for staff, and directors will do contact tracing for students. Staff will report information about proximity, location, and duration of contacts throughout the day to HR or the director when required. Visitor logs are kept at both schools, and any substitute staff or changes in people within the building are documented by the school director. It is no longer required that students are separated into cohorts at our schools. Unvaccinated student exposure when both parties were wearing masks. When both parties were wearing a mask in any school setting in which students are supervised by school staff, including indoor or outdoor school settings and school buses, including on buses operated by public and private school systems, unvaccinated students who are close contacts more than 15 minutes over a 24-hour period within 0 to 6 feet indoors may undergo a modified quarantine as follows. They may continue to attend school for in-person instruction if they are asymptomatic, continue to appropriately mask as required, undergo at least twice weekly testing during the 10-day quarantine, and continue to quarantine for all extracurricular activities at school, including sports and activities within the community setting. Quarantine recommendations for unvaccinated close contacts who were not wearing masks or for whom the infected individual was not wearing a mask during the indoor exposure or unvaccinated students. For these contacts, those who remain asymptomatic, meaning they have not had any symptoms, may discontinue self-quarantine under the following conditions. Quarantine can end after day 10 from the date of last exposure without testing. Quarantine can end after day 7 if a diagnostic specimen is collected after day 5 from the date of last exposure and tests are negative. To discontinue quarantine before 14 days following last known exposure, asymptomatic close contacts must continue daily self-monitoring for symptoms through day 14 from last known exposure and follow all recommended non-pharmaceutical interventions. Example, wearing a mask when around others, hand washing, and avoiding crowds through day 14 from last known exposure. If any symptoms develop during this 14-day period, the exposed person must immediately isolate, get tested, and contact their healthcare provider with any questions regarding their care. Directors will maintain a spreadsheet for student exposures. Students who develop symptoms of COVID during the school day will be isolated in a room away from others, and parents will be contacted to remove the child from school. Adults who develop symptoms will be sent home. The COVID decision tree will be consulted to evaluate isolation symptoms for students. The schools will provide regular and frequent access to hand washing facilities. At a minimum, hand washing will occur upon arrival at school, before and after eating, after toileting, upon return to school from being outside, after sneezing or coughing, and prior to boarding transportation home. Staff will accompany students needing support to assure that hands are washed thoroughly. Hand sanitizer is available in all classroom and other spaces throughout the school should hand washing not be possible. When choosing cleaning products, the Learning Academy and Country School use those approved for use against COVID-19 on the Environmental Protection Agency approved List N and follow product instructions. The schools use only these products for cleaning and disinfecting. School custodians are trained in the safe use of disinfectants and use disinfectants labeled to be effective against emerging viral pathogens, following label directions for appropriate dilution rates and contact times. Custodians are provided training on manufacturer's directions, on Cal/OSHA requirements for safe use, and as required by the Healthy Schools Act, as applicable. Custodial staff are provided with PPE specified as appropriate for the products they use. All disinfectants are kept out of the reach of children and stored securely. Most schools are cleaned and disinfected each evening. Agency vehicles used for school outings will be disinfected daily at the end of the school day. If a vehicle is used for more than one group, the vehicle will be sprayed with disinfectant and not used until this is dried and the vehicle has been aired out. Individuals cleaning vehicles will wear gloves and disposable masks while cleaning. TERI non-public schools limit non-essential visitors, volunteers, and activities involving external groups or organizations during COVID-19. Essential visitors are screened prior to entering the building.